Hello, everybody. It's July 10th, 2021. It's a Saturday. The markets are closed. We're enjoying ourselves this weekend. Um, Not too hot. I thought it was gonna be hot today, but it's cool. Yeah, so let's talk about some old news. You know me, I like bringing up old shit over here. When it comes to healthcare, I can't forget, especially when it's some bullshit. Is it bullshit? I don't know. We'll talk about it. So, Blue Shooter California and Gavin Newsom, they are in bed together. Apparently, I don't know. Gavin Newsom supports LGBTQ rights, right? He was known for that as a mayor in San Francisco. So CEO Paul Markovich, that's him here on the left. Gavin Newsom, right there. So pretty much, Gavin Newsom, I guess he didn't want the pressure of the vaccine rollout. The technology here in California, especially the government technology, it's pretty shit. So they were already underfunded. The healthcare department here in California was already deep, like they didn't have too many funds. So I don't know, for whatever reason, I think they bid out the contracts, but pretty much Blue Shooter California got the contract to do the vaccine rollout. Kaiser had its own little program, but that's something else. So Blue Shooter California pretty much managed the rollout, and California was most privatized rollout in the whole US. In other states, there was like combinations of private corporations like Massachusetts and Florida, but California, damn, the most privatized rollout. Um, yeah, but this is where it gets a little iffy because Blue Shooter California, they have been buddy buddy with Newsom for over the years. So Blue Shooter California contributed $300,000 to Newsom's re-election campaign. That was back in 2019, 2020. And then they also spent $100,000 on his inauguration. And then Gavin Newsom had an effort to address the homelessness, and Blue Shooter California contributed $20 million, right? Damn, that's a good amount of money. Um, so yeah, I mean, it's not like these corporations are giving out money just for the fuck of it. No, they want something in return. And this is where people start to get a little iffy. So, for example, the CEO of the Martin Luther King Community Hospital here in South Central, she felt that they were almost forced to get the contracts. I mean, a lot of providers, it's not just her, so many different clinics, hospitals, you know, they were at risk of if they don't get the contract, if they don't accept the agreement with the Blue Shooter California, then they're at risk of having more logistical issues. And there was another article where it talked about there was only one county that opted out. Fuck, I forgot what county it was. But pretty much all these other counties, people were so scared, like fuck, we have to agree because who else is gonna give us the vaccines? I don't know, it gets a little tricky. I did not partake in any of the vaccine rollout. I got my vaccines. Shit, I got that shit from Walgreens. I have no idea the back end to that shit, but I got it from Walgreens. And I went late to my vaccine. And to be honest, I got that shit. I got COVID earlier this year, but I still got it because I need to do my fucking part. And I got a bunch of people that don't believe in the vaccine. And we'll talk about it later on this video. But yeah, and then this dude here, I just thought this was funny. A Republican from Fresno, Jim Patterson, the way he talked, like the way the private sector and the government ought to act. So he was pretty much saying, it's good that Blue Shooter California is partnering up with the government. It's just the wording. They ought to act. Um, Jim Patterson, if you Google him, Jim Patterson, that dude's 73 years old. I was like, oh shit, no wonder. That's why he talks like that. But that's pretty funny. Um, there was another article. So somebody from the UC system, there's a representative, Heather Harper. She kind of voiced her concerns that Blue Shooter California, why the fuck are they gonna do this? Because on their contract, so this is their contract. They're getting paid $15 million for the whole rollout, 5 million for the providers, 5 million for delivery, 5 million for marketing. and they can't make money. They can't make this profitable. So why the fuck are they incentivized to do this? Why the hell do they want to do this? Is it because they want to be seen as the heroes? Like, oh, was it? And to be honest, nobody fucking knows about Blue Shitty. Like, it's not that they want to be heroes, right? Because when you think the vaccine rollout, nobody's, oh, it's because of Blue Shitty California. They did their thing. Nah, no, ain't nobody talking about Blue Shitty California. So why the fuck are they doing this? So this is where they're voicing the concerns about data. So the reason why, well, at least this is what this representative is saying, the reason why Blue Street California wants to do this is because they want access to this data. When people get the vaccines, when claims get submitted to Blue Street California, they want data on the individuals, the patients, and in this article it talks about they can use this information to target geographic areas to expand and grow their market, quality requirements, all this different shit. In healthcare, data is fucking valuable. So this is probably why. But then, of course, the LA Times, they reached out to the Paul Markovich, and he was like, oh no, we ain't doing it because of data. Fuck no. Why would we do that? Why would we put our reputation on the line? But this is, you have to say that as a CEO, you have to say that shit. Um, is he gonna use it for data? I mean, fuck, they have to, right? They have they have data. They gotta use it. Why wouldn't they? And it gets a bad rap, but as a company, you need the fucking data. But of course, they're not gonna tell the public they're gonna use it. And to be honest, if they're not gonna use it, then all right, cool, don't use it. But as long as you're not using it for the wrong intentions, um, yeah, people want the privacy. Here's another photo. This is from January 28, 2020. So this is way back, way back, before COVID, right? January 28. Fuck, I don't even remember. Paul Markovich, the CEO of Blue Shooter California, Gavin Newsom, this other dude. Not exactly sure who that is, but I don't know. This is kind of funny. They prop up their plants on some books. Pretty weird. Um, Interesting stuff. Not sure why. Probably some rich people shit. I don't know. This is something funny I just saw on YouTube when I was like Googling Gavin Newsom. He apologized for fucking the homie's wife. I was like, oh wow, this dude's wilding out here. This was back when he was a mayor. Um, yeah, and then there's this other article. So all these articles was back in March. I should have mentioned that. This was all super early in March, right? Fuck, this is February. Some of these were from March. This was from March 22nd. So now this is more recent, June 29th. So that's about 2 weeks from the making of this video. And this article just talks about how, Gavin Newsom, he's boasting himself, he's like, I'm the shit, we're doing good compared to other states. 60% of Californians are fully vaccinated, right? But it's not even, according to this article. 39% of black people, 40% of Latinos, or as Biden wants to call it, Latinx, they're fully vaccinated. And I guess Asians, Caucasians, maybe they're making up for that 60%. Um, yeah, and it just talks about, maybe this rollout, especially for the people that don't trust healthcare, African Americans, fuck, they have it bad, right? It's a Tuskegee experiments. Why the fuck are they gonna get the vaccine? They don't trust that shit. Um, so yeah, they were just saying how maybe the better rollout would have been to just do it community-based, local clinics, local hospitals to begin with. And of course, they ended up doing some of that shit. They had a fucking lottery, $116 million lottery. Fuck, that's more than the $50 million to contract the goddamn Blue City, California. This fucking, they're spending, they're spending more money now. They could have spent more money earlier. It probably would have been a better rollout. They're fucking paying social media influencers, like goddamn marketing campaign and shit. But yeah, this is, I mean, it's not my fucking expertise, right? I mean, eventually I would want to learn all that shit, but fuck. It's crazy, man, because these people that don't want to get the vaccines, they're not gonna fucking get it. Um, I got one of the homies, fuck, that fool's, he's a conspiracy theorist, right? Fuck, I don't know. So people like that, you have to respect their opinions. You can't force them to get a vaccine. And how do we make these people understand? Is by building trust. Who has the most trust? It's the local government would have more trust, right? Or you would assume, right? People you see every day, you trust them more than a fucking stranger. But yeah, so that's what this article talked about. You know, now they're having trouble getting a dozen people vaccinated. 12 people, right? When before, you know, fuck, they're doing 15, you know, they're doing thousands of vaccines. But yeah, of course, it's declining, plateauing. People that wanted the vaccine already got it. People that don't want it, they're not, you know, if it's already July, if fuck, it's gonna be really hard to get those people. But yeah, I think it was pretty interesting. Gavin Newsom, Blue Shoe to California, you know, they're in a relationship, and you know, I guess it might be an open polygamous relationship because Kaiser was able to do its own program. But yeah, but yeah, it's always interesting. You know, I'm here for the drama and shit. So fuck. I mean, hopefully we get this fucking virus over with. We got the Delta variant already, but I don't know. Hoping for the best. I'll catch you guys later. Let me know what your thoughts are. Go ahead and drop a dislike in the video. I don't really care. All right, see ya.